Welcome to the Cannabinoid Medical Clinic. This video that you're about to watch is going to help orient you to the clinic and prepare you for the visit with a physician today. If you haven't already received our handbook on medical cannabis, please ask the medical receptionist to give you your very own copy. This book is yours to take home, and it has all the information that we want you to have. At the bottom of every slide that you are going to see today is a page number that correlates with a page number in this book, so you're able to follow along as we go. Feel free to take notes and ask one of our staff members later. Over the course of the next 15 minutes, I would like to discuss a few things with you. I would like for you to be able to understand a little bit about the science of medical cannabis and why this is a viable option. I also want you to understand the difference between cannabinoids and medical cannabis. I would like for you to understand how to access herbal cannabis if your physician decides that you are a candidate and gives you a prescription. And I also want you to be aware of what to expect and not to expect at your first visit at the clinic here today. Let's talk about the endocannabinoid system. The endocannabinoid system is a signaling system within the human body. Very similar to things like neurotransmitters or hormones, it helps to regulate many aspects of the human body. It helps to regulate things such as our feelings of anxiety, our feelings of being awake or asleep. It helps to regulate our appetite as well as nausea, and it can also modulate the sensation of pain. There are three main components to the endocannabinoid system. First off, cannabinoids. Second off, signaling molecules. And third off, cannabinoid receptors. So what are cannabinoids? Cannabinoids are an integral part of the endocannabinoid system. It's actually a whole class of compounds that can bind to cannabinoid receptors and influence the endocannabinoid system. There are more than just one type of cannabinoids. Cannabinoids can either be found within the human body, those are called endocannabinoids. They can be found in nature, in plants, those are called phytocannabinoids, or they can be synthesized in a laboratory, those are called synthetic cannabinoids. The endocannabinoid system, much like many other systems in the body, can be thought of as a lock and key mechanism. In this scenario, the lock are cannabinoid receptors and the keys are cannabinoid molecules. When the key or the cannabinoid molecule binds to the lock or the receptor, it actually unlocks the mechanism and has an influence on the body. So it will either open or close, and what sends the signal to open and close are signaling molecules. Cannabinoid receptors are on almost all surfaces of cells. It is what the cannabinoid molecules bind to. There are actually two different cannabinoid receptors that have been identified. Those are cannabinoid receptor 1, or CB1, and cannabinoid receptor 2, or CB2. These two receptors are located in different parts of the body. Their CB1 receptors are located throughout the nervous system and the gut, while CB2 receptors are located in the immune system. Signaling molecules are those molecules that are produced after the cannabinoid receptors have been activated and go on to exert their function on the rest of the cell, and consequently its effect on the human body. CB1 receptors are found throughout the nervous system and the gut. What's interesting to note is that there's actually a lack of CB1 receptors in the brainstem. Why is this important? It's important because the brainstem is where the respiratory center is. If you were going to stimulate the respiratory center, this would cause respiratory depression and death. This is the case when someone overdoses on opioids. Cannabis, unlike opioids, does not cause respiratory depression and death, no matter how much cannabis you consume. Therefore, this class of medication can be considered relatively safe. especially when we compare it to such things as opioids or narcotics. As we mentioned before, there are different types of cannabinoid molecules. The ones that we produce on our own are called endocannabinoids. There are two different ones that have been identified and bind to the various CB1 and CB2 receptors differently. Through their interaction with these receptors, they exert an influence on the human body. Phytocannabinoids are cannabinoids that are found in nature, and specifically in plants. Phytocannabinoids are found in many different plants, but in highest quantity and density in the cannabis sativa plant. Because they're cannabinoids, when they bind to cannabinoid receptors, they can have a similar action on the human body as do our endocannabinoids. Phytocannabinoids can be accessed through herbal cannabis, but there's also a medication that you can get in the pharmacy called Sativex or nabiximols that is actually an extract from the herbal cannabis plant and has phytocannabinoids or naturally occurring cannabinoids within that medication. Synthetic cannabinoids are cannabinoids that have been synthesized in a lab. So they are not natural, they are man-made. Synthetic cannabinoids can be accessed through a prescription, and they come in a capsule form. You can get them on prescription from your doctor and get them in your local pharmacy. The name of the medication that we have is called Nabilone, which is the generic name, or Sesamet, which is the brand name. Synthetic cannabinoids have a very similar effect to herbal cannabis. They exert the same effect on the human body and bind to the same receptors as do herbal cannabis. Using a prescription cannabinoid has both its advantages and disadvantages. On the plus side, it has been very well studied, and it has very well known side effects and duration of action within the human body. It's also actually covered under most provincial and private healthcare plans. On the downside, once you take a capsule, it's in your system for a certain amount of time. So if you only need it for 1 hour, it may not be the right medication for you. So how cannabis works. Cannabis is actually composed of over 400 different molecules. Of these 400 molecules, about 80 of them are cannabinoids, or molecules that can bind to cannabinoid receptors, and the remaining molecules are called terpenes and flavonoids. Terpenes and flavonoids are those molecules that lend the taste and the smell to cannabis, but also might have a physiologic effect on the human body. Of the 80 different cannabinoids that exist in herbal cannabis, there are two that are thought to be the most important and have the greatest amount of effect on the human body. These two molecules are called THC and CBD. Now, it is not just the two molecules, THC and CBD, that are important in terms of having a function on the human body. We actually believe that it is THC and CBD and their interaction with the other 400 molecules that really provides and explains why herbal cannabis as a plant with all the molecules can be more effective and have more therapeutic benefit than just providing a patient with a single molecule. This synergy between 400 different molecules is what we call the entourage effect. THC and CBD are the two main active ingredients in cannabis. THC, or delta-9 tetrahydrocannabinol, is actually the only cannabinoid of the 80 plus cannabinoids that it makes you high, or is what we call psychoactive. Just because it makes you high, it doesn't mean that it does not have a place in medicine. Aside from its euphoric effects, it is also a very good acute painkiller, as well as helps to control nausea and vomiting. It may have other benefits as well, including helping with spasticity or with sleep. It can also have negative side effects such as a rapid heart rate, paranoia, and may worsen seizures. CBD, or cannabidiol, the other main cannabinoid, is actually a molecule that will decrease the psychoactivity of THC. It is also thought to be more anxiolytic, or decreasing one's anxiety, as well as anti-inflammatory, and may have a host of other beneficial effects. You can read more about this in the Handbook for Medical Cannabis. Each strain of cannabis has its particular THC to CBD ratio. That means that you can have twice as much THC to CBD or vice versa. Depending on the ratio of THC to CBD, you may experience different effects. Cannabis with a very high THC and a very low CBD may give you an effect of euphoria, pain killing, and appetite stimulation, whereas a different strain that has a high CBD and a low THC content might give you a feeling of well-being, relaxation, and pain relief. Every time that you buy cannabis from a licensed producer, it will have a specific THC to CBD ratio. It may take some time to figure out what strain or strains of cannabis are right for you. Medical cannabis that is provided to you by licensed producers is tested for its percentage of THC and CBD. What is medical cannabis as opposed to recreational cannabis? First of all, medical cannabis is plant matter derived from the cannabis sativa plant. So medical cannabis is used to treat symptoms or diseases as opposed to being used for recreational or spiritual purposes. Medical cannabis is cannabis that has been grown in a Health Canada approved facility under the MMPR system. That's Marijuana for Medical Purposes regulations. Medical cannabis has also been tested. It's been tested for impurities such as bacteria, mold, and heavy metals. And it has also been tested for its concentration of THC and CBD. How to access medical cannabis? Medical cannabis can only be accessed under the MMPR system with what is called a medical document. A medical document is the same as a prescription. In order to obtain a medical document, you have to go see your healthcare practitioner and discuss whether herbal cannabis is right for you. During the consultation with your physician, they will discuss whether you are a candidate for treatment with cannabinoids, consider both herbal cannabis as well as prescription cannabinoids. Those include Nabilone and Sativex. The medical document is very similar to a prescription that you would get for a traditional medication. Instead of telling you how many pills to take in a day, it tells you how many grams you may consume of herbal cannabis per day and a length of time for up to 1 year. Medical cannabis can only be accessed legally under the MMPR system from a licensed producer. A licensed producer is a company that has been approved by Health Canada to grow, sell, and distribute cannabis to patients with a valid prescription or medical document. Licensed producers are not allowed to have a storefront, and they are not able to dispense their medication in pharmacies. That means that the only way that you can get your medication from a licensed producer is by mail or via bonded courier. Licensed producers must also comply with very strict regulatory oversight by Health Canada. That means that the medication they produce is free from any kind of contaminants and safe for your consumption. How to select a licensed producer? There are numerous licensed producers that have been approved by Health Canada from which you can buy your medication. It is ultimately up to you to decide which licensed producer you will sign up with. Our patient care coordinators are here to help you in that process. In order to figure out which producer is right for you, it's important to ask yourself a number of questions. These include, what is most important to me? Is it cost? Is it consistency of product? Does the licensed producer have a range of product or the specific strains that you and your doctor agreed are right for you? Please think about the various things that are important to you when choosing a licensed producer, and one of our patient coordinators will help you choose one that is right for you at the conclusion of your appointment with your physician. At your first visit at the Cannabinoid Medical Clinic, you can expect to spend between 60 and 90 minutes. At the beginning of your visit, you will receive a patient handbook, which hopefully you have already been using and following along during this presentation. You will have a thorough intake session with one of our patient coordinators who will review your history, provide you any further education, and start a brief physical examination. After that, you will have a consultation with one of our physicians. The physician will spend some time with you reviewing your patient history, doing an examination, and coming up with a treatment plan. At that point, they will either give you a prescription for herbal cannabis or one of the prescription cannabinoids, such as Navalone or Sativex, or tell you that you are not a candidate for herbal cannabis. If you do receive a prescription for herbal cannabis or a medical document, then one of our patient coordinators will work with you to figure out which licensed producer is best for you and your needs, and help you with all of the paperwork that you require in order to apply to become a patient at that licensed producer. You should also be aware that we ask all of our patients for a urine test at their first visit, as well as at every subsequent visit. Let's also talk about what not to expect at your first visit at the clinic. Just because you get a consultation with a physician, it does not guarantee that you will get a prescription for herbal cannabis. You should also be aware that there is absolutely no herbal cannabis on site. The other thing that you should be aware of is that during your visit here, you will not be asked to pay a mandatory fee. All of our physician-covered services are free of charge. Thank you for watching our video, Introduction to Herbal Cannabis. Hopefully, this has been educational and useful, and will have prepared you for your consultation with a physician.